All right, we're going to do the radiographic projections of the hand. We're going to start off with the PA hand, having the patient seated at the end of the x-ray table with their side to the table and their forearm down on the table with their palm down flat. That's the PA projection. We're going to have the central ray directed to the third MCP joint, fingers slightly spread apart, and a little bit of collimation around the edges of the image. Put the correct marker on there, and as long as you've shielded your patient, that's everything you need to do for the PA hand. If you're using a digital image receptor, then you're going to put all the images on a single image per image receptor. But if you're using analog, we're going to put 2 images on one, and we're going to use a 10 by 12 and collimate to half of the size of the 10 by 12 film. We're going to have the patient make the OK sign with his hand, and that's the oblique projection of the hand. Get that right there. That's the oblique projection of the hand. For the lateral, we're going to lift his hand up, slide the image receptor over, and put his hand down laterally so that all of the metacarpals are stacked right on top of each other. Put the thumb out to the side and place the marker with that image. And that's the procedure for the hand. That's it. For the procedure of the wrist, we're going to do 3 views, a PA, an oblique, and a lateral. And for a analog system, we're going to put all 3 of those procedures, all 3 of those projections on one image receptor. If it's a digital system, then each of these are going to be on their own 8 by 10 cassette. So for the first one, we're going to we still have the patient seated at the end of the table with their arm bent, forearm down flat on the table. We're going to collimate to about 4 inches by 10 inches. And start with the patient there, and we're going to center his wrist, the carpals, to the center of the first third of the cassette. We're going to make sure that we have the patient curl his fingers up underneath his hand to reduce the OID of the carpals. And that's the PA projection of the wrist. For the oblique projection of the wrist, we're simply going to lift his wrist up, slide the cassette over towards the center, the collimated field to the center of the cassette, place his wrist back down, and rotate his wrist up 45 degrees. That's the oblique projection of the wrist. And for the lateral, we're just simply going to slide it the rest of the way over, put his wrist in a true lateral position, use this projection to add our marker, and as long as we've shielded our patient, measured, and used a technique chart, that'll give us a good study of the wrist.